Welcome back, guys. Today we're gonna talk about the pectinate line. It's also called dentate line. It's dentate line because there is two embryological origin meet in this area. Endoderm, which mainly compose the GIT tract, and the ectoderm mainly compose the skin on the outer of the body. So we gonna do comparison between the area above the pectinate line and the area below the pectinate line to make it easy to memorize. So the innervation for area above the pectinate line is visceral innervation. That means there is no pain. Okay, but the area below the pectinate line is somatic innervation, so there is a pain. We can feel it because it's somatic. Artery, the artery supply the area above the pectinate line is from the inferior mesenteric artery, which originates from the abdominal aorta, but the area below the pectinate line is from the inferior rectal artery, which is branch of internal pudendal artery. The veins, which is the most important one, the veins from the area above the pectinate line is from the drain into the portal vein. It's from the inferior mesenteric vein. So the course of the vein drain from the area above the pectinate line is superior rectal vein to the inferior mesenteric artery to the splanchnic vein, as we said in the portal systemic circulation. The area below the dentate line is it's drained to the systemic circulation. So it is inferior rectal vein drained to the internal pudendal vein, to the internal iliac vein, to the common iliac vein, and on inferior vena cava. So the lymphatic drainage also drain to the internal iliac node, internal iliac lymphatic node from the above the pectinate line, and the area below the pectinate line drain to the superficial inguinal ligament. So the area above the pectinate line drain to the internal iliac lymph node. The area below the pectinate line drain to the superficial inguinal lymph node. Okay, so let's talk about the hemorrhoid here. If the hemorrhoid above the pectinate line, it will be not painful. Okay, because as we know, or as we said, it is from the visceral innervation, so it will be not painful even if it gets thrombosed. Okay, and also called internal hemorrhoid. The external hemorrhoid, when we say the external hemorrhoid, we mean the hemorrhoid below the pectinate line, and it is also not painful, but it became painful when it gets thrombosed. Also we have adenocarcinoma above the pectinate line and squamous cell carcinoma below the pectinate line, because the epithelium below the pectinate line is squamous, but above the pectinate line it is cuboidal. So there is no squamous cell carcinoma above the pectinate line. Also we have an anal fissure. Anal fissure, it's most probably caused by mesenteric defecation and make the mucosa or submucosa area injury. Usually it's below the pectinate line and it is painful while defecation, and if there is a blood with a stool after the end of stooling, so the patient will notice the blood when he using the toilet paper after defecation. Usually located posteriorly because this area is poorly perfused. Innervated by pudendal nerve, as we said, it is usually below the pectinate line, so it's innervated by pudendal nerve, so that is why it is painful. Associated with low fiber diet and constipation, as we said before.